Hey, hello. I'm just going to review real quick the principles of delegation that you learned in fundamentals and prioritization, just some kind of tips to help you through this multiple patient simulation. Now, in this multiple patient simulation, there's going to be a group of 5 to 6 students. One of the students is going to be the primary nurse. There will also be a charge nurse in the scenario. Don't be afraid to lean on your charge nurse and ask for help if you're unsure of what to do. There'll be an offgoing RN. The offgoing RN is just going to update the primary nurse and the team on a few things that may have happened in the last, couple of minutes, since you did already get report on your patients, okay? So don't forget to come in to the simulation, with some knowledge of your patients, okay? There's also going to be an LPN on the team and an unlicensed assisted personnel, or a UAB. Okay, so and then there will be one family member if we do have a 6th person in the group. Okay, and the family member is going to be with the GI bleed patient. Okay, so I'm going to just go over these principles of delegation first, and then I'll talk about priorities. So with delegation, don't forget about the 5 rights. You want to delegate the right task, okay? So something that you can legally delegate to a patient. You want to make sure it's under the right circumstances, right? So if the patient's stable, you can delegate vital signs, right, to the UAB. And then if you have somebody that's sick and you're busy with another sick patient, you might delegate to the charge nurse, okay? Because that's another RN that you could delegate to. You want to make sure you're giving the right direction or communication. So be clear in your communication. After you gather in the morning for report, the primary nurse is going to delegate, start delegating what you want the members of your team to do, like what assignment, what are you going to tell the LPN to do for you, and what are you going to have the UAB do for you. Okay, so you have to keep that in mind, and you want to make sure that if you're delegating, you're providing the right supervision. So you need to evaluate the results of the task. So provide feedback, especially to an unlicensed personnel. Okay, now you're going to have to delegate tasks. Now I have a Quizlet that goes through what you can delegate to who. Okay, so I would just, go there. It'll take you like 5 minutes to just go through all those. You probably remember them from fundamentals. But I'm going to give you a basic guideline. Don't delegate tape. So teaching, and that means initial teaching. You can't have an LPN do initial teaching for you, but you can have them reinforce teaching. A UAB cannot teach for you. They can orient somebody to the room, to the call bell, but they cannot teach for you. Assessment. Now this confuses students because you can delegate data collection to a LPN. Like you can ask the LPN to go listen to somebody's lung sounds, listen to bowel sounds. That's data collection. An assessment is when an RN puts the whole picture together, right? If I do an abdominal assessment, I'm going to look at, what their abdomen looks like, right? I'm going to listen to their abdomen, palpate their abdomen, ask about their bowel movements, what kind of diet they're on, what other kind of symptoms are they having. You have to kind of put everything together. Don't delegate planning and don't delegate evaluation. Okay, so those are just some things to keep in mind for delegation. But don't be afraid to delegate. Oftentimes when students come back and visit me after they've graduated, I always ask them, how is your delegation going, okay? Especially if they're working on med-surg. And the reason I want them to learn to delegate is because as the RN, the head of a team, because now they're going to a model in the hospitals around here where the RN is going to be paired with an LPN and a UAB. And you have to get good at delegating, because as the RN, you have to be able to think, okay? And if you're running around all day, you're not going to have time to think, and you're going to miss those early cues that somebody is, heading towards trouble, okay? So you want to be able to pick up on those early cues, so you will have to delegate. When I first became a nurse, I learned a lot by, charting and reading patients' charts, okay? And, just pausing for a little bit, you can think about how your patients are doing, okay? So don't be afraid to delegate. You need to learn how to do it effectively. Okay, so now we're going to go into prioritization. Students sometimes have trouble with priorities, especially on exams, so I'm going to give you a few tips. The first method I'm going to kind of go over with you is the ABC method. You've probably heard of that before. And I go over the ABCDE method, and when you get to fifth semester, we go into a lot more detail with this, but I'm going to give you some really good tips that you can use in Med-Surg 1. Okay, so A is for airway. If your patient is talking to you and their voice is clear, they have an airway, okay? So you don't need to worry about that. Breathing, you want to know that your patient is breathing. Look at their chest. Is it rising symmetrically? Listen to their lung sounds. What do you hear? Circulation is next. And with circulation, you're looking at like heart rate and blood pressure, but also urinary output. Students often miss that because your kidneys receive about 25% of your cardiac output. So if your heart is not pumping effectively, you're going to have a low urinary output. You want to feel their pulses. +2 is a good pulse, means the amplitude is adequate. You want to know if their skin feels warm and dry, or is it clammy and sweaty? We don't like that, okay? You want to know if their cap refill is brisk. It should be brisk. And, if their blood pressure is starting to go low, if they're warm, they could have septic shock, or if they're cold, they could have hypovolemic shock, okay? Now, D is something you may not have heard about before, but it stands for disability, okay? So this is like somebody's neurostatus. So you want to, you might do a Glasgow Coma scale. You won't have to do that in this simulation, but you're looking for, is the patient alert and oriented, or are they confused? How are they doing? The other thing you can do here for disability, you can think about like somebody that has a change in condition. That's something you want to see pretty, right away if you don't have an A, B, and C. And then E is for exposure or environmental. So like, if somebody's hypothermic, or, the environment, you want to make sure the environment is warm enough for people and they're warm enough. You want to make sure they don't have a fever. So those are just some of the things you can be thinking of when you're prioritizing. Now, the next method you learned in fundamentals and in also Nursing 100. So it's Maslow's hierarchy of needs. Now, you always have to remember to do your physiological needs first, okay, when you're prioritizing, and then safety needs. Now, students love to run to patients with pain, okay? If somebody's post-op, you expect pain. So if it is a pain that is expected for their condition, okay, if it's not something that's new, if it's not chest pain that you think is cardiac, or ripping chest pain that you think, somebody has a dissected aorta, then it's probably not as important as you think. So it's always hard to give advice about that because you'll get 4 patients, which one are you going to see first? It depends on the other patients as well. But as a general rule, pain that's expected is not going to be your priority most of the time. There'll probably be somebody else in that mix that you need to see first, okay? All right, so remember that safety, then love and belonging, esteem, and self-actualization, okay? So remember that is a good way to prioritize as well. You always take care of acute conditions versus chronic conditions. Okay, so that's another thing to keep in mind. Also, stable patients versus non-stable patients. Okay, so if you have a patient in the scenario that is unstable, what you're going to do is you are going to you're going to have to delegate, vital signs or whatever that patient needs. Maybe they want like something to eat or drink, delegate that task to somebody else while you're taking care of the patient that is unstable. Okay, so remember that. All right, that's it. Short and sweet, just a little review. And some tips, and thank you for allowing me to give you this presentation. I always look for excuses to get in the classroom and teach again. And I will see you in the simulation. Bye.